everyone, and welcome back to the HeRO Whiteboard. I'm Will King. Today's topic is intubation and extubation. We'll start today by revisiting a graphic that we saw in the session covering the predictive accuracy for infection, where we examined spikes in HeRO score. That is, events where the HeRO score was trending along nice and low for a number of days and then rapidly rose over a 24-hour period. The number one reason for these spikes in HeRO score was respiratory deterioration, accounting for 35% of these rapid increases. Further, when researchers looked at predictors of unplanned intubation in the NICU, they found that the HeRO score was the best predictor, with an ROC area of 0.81. They noted that predictive monitoring for urgent, unplanned intubation may improve outcomes by allowing clinicians to intervene non-invasively before intubation is required. Turning to extubation, a group of HeRO users in the UK studied HeRO scores immediately prior to extubation, as well as the HeRO trend after extubation as predictors of extubation success. They found both the baseline HeRO score as well as the trend in HeRO score were significantly higher among patients that eventually failed extubation compared to those who succeeded. So we worked with them to develop online clinical decision support tools to assess extubation readiness while a neonate is intubated and predict extubation success in the period after extubation. Both of these tools are available on our website at www.heroscore.com/extubation. The pre-extubation model uses a number of readily available clinical parameters to estimate the probability of reintubation if the patient were extubated at the current time. This model can be used without HeRO and is applicable to any premature patient, although HeRO scores can optionally be entered to further inform the model and make it even more accurate. The post-extubation model uses similar clinical parameters to show a dynamic plot of risk of reintubation in the time period following extubation. And the user can optionally enter additional clinical parameters as the status of the patient changes to compare their current trajectory against baseline. We believe these clinical decision support tools have the potential to inform and supplement the confidence of clinicians considering extubation and reintubation in preterm infants. To summarize, respiratory deterioration is a major cause of rapid rises in HeRO score, and HeRO is an excellent predictor of need for intubation. HeRO predicts extubation readiness and extubation success, and online calculators are available for all to use at www.heroscore.com/extubation. As always, references are available on our website at www.heroscore.com/HeRO-publications. We appreciate your time in watching this series on HeRO monitoring. If you found this session valuable, make sure to hit the like and subscribe buttons so you will see future sessions as we release them. And give us your feedback by leaving comments below or sending me email directly at wking@heroscore.com. Thank you for joining us, and we'll see you next time at the HeRO Whiteboard.